Hello students, I am Sheena Costa, your health educator here at Manovika's English Medium School. How is everybody doing? All of you at home must be anxiously waiting to come back to school. It's a difficult time, everybody misses you, and we hope that this ends very soon and you'll be back with us. In the meantime, I'm here to talk to you about a very important topic that I'm sure you must have heard a lot about over the last month or so. As many of you may have guessed correctly, I will be talking to you about COVID-19. Now, here we go. COVID-19 is a disease that started off in December of 2019. Many of you might already know this, that it originated in the city of Wuhan in China. And COVID-19 actually is the disease caused by the virus coronavirus. So the full form of COVID actually, CO stands for corona, VI stands for virus, D is disease. So coronavirus disease, and because it originated in the year 2019, it is called COVID-19. Now, talking about viruses, coronavirus is a virus among many other group of viruses that can cause various diseases amongst humans. Viruses are present everywhere. There can be millions of them around us. We cannot see them with the naked eye, but if you put them under a microscope, we would be able to see them. So one such virus that has come to town now is called COVID-19. Many of you must be anxious, worried that you may get it. So it's very important that we learn more about this disease and what it can cause so that we are more ready to take on the virus. The more we know about it, the less anxious you will be. You'll feel more empowered. You can even talk to your families about the disease so they can be less afraid of it. So this lecture should help you understand a little bit more about it. Corona, the word corona actually came from the Latin word crown, and that's simply because the shape of this virus, if you can see at its periphery, it looks like a crown. Under the microscope, if you have a look at this virus, it looks like a crown which has these spikes that you can see here. These spikes are protein spikes that actually inject into a human cell, and then the virus gets transmitted into the body. This is another animated picture that I've put up here so that you can have an understanding of what these spikes look like, what the shape of this virus looks like when we look at it under the microscope. Now, this virus, although it is a small virus, it can cause a lot of problems for us, and you'll see in my next few slides. Like I said, viruses are these tiny germs that they are non-living creatures that do not have any DNA. They have something called RNA, and they require a host to live. So what I mean to say is, this virus it's not a living being. It can only continue to live if in a host, such as a human being. So if it enters our body, which mostly it can through your mouth, your eyes, or your nose. These are the different routes that it can enter. It can go into your respiratory system, attack the cells of the respiratory system, and then cause various symptoms that we'll be talking about. Think of it as this coronavirus shows symptoms just like similar to the flu. You can call this virus sort of friends of the flu or sort of cousins of the flu. Many of you may have had a cold before, a flu before, and you would have had very nasty symptoms like runny nose, sore throat, all of these things. Now, coronavirus can present with similar symptoms, but the three striking symptoms or classic symptoms that can be seen in most corona-positive patients are a very dry, itchy cough. You can also have fever, which is a very classic symptom. Any infection will present with a fever. So you can be sure that if somebody's got fever along with these three symptoms, they may most likely have the virus. And when the disease progresses and becomes very severe, a person can find it very hard to breathe. They can have shortness of breath, and can also lead to further illnesses such as pneumonia, which can then lead to death. Now, you might wonder, does this affect children, or who does it affect? Now, remember that corona can affect people of all age groups, but the most vulnerable population are older adults, like our grandfathers, grandmothers, aunties, uncles, anybody who's older and also has pre-existing conditions. They may be sick from diabetes, they could have cardiovascular problems, other pre-existing respiratory problems. If they have that, then corona can create further problems for them. But remember, in children, so far, it has been found that it doesn't affect children that much as compared to older adults. So the cases that have been found so far of corona are very mild among children, so not to worry. So like I said, mostly older adults are vulnerable to this virus. Now you might want to know, this virus seems scary, how do we get rid of it? How do we treat it? Usually for most viruses such as the flu, there already have been vaccines that people can take to prevent the infection. But since corona is a novel new virus, so far they have not come up with any vaccine that can help treat it. Hence, only symptomatic treatment can be provided. Right now, there are several countries that are working very hard to produce a vaccine that can help prevent further infection and will increase the number of cases, will help reduce the number of cases. So, only drugs, certain drugs which can help are to reduce your fever symptoms, to help you with your cough, only to help with your symptoms, but will not actually cure the virus. Now, I'm sure you must have heard a lot of information from like the TV, newspapers, especially from on social media, on WhatsApp. There's lots of information out there about the virus that can be very overwhelming. You can get anxious from even reading it. So I urge you not to follow each and everything that you see out there on social media or newspapers. Try to learn from reliable sources. Talk to your parents about reading from reliable sources such as the World Health Organization, the CDC, which is the Centers for Disease Control and Prevention. You can also use the Ministry of Health and Family Welfare, government websites that produce reliable information and credible sources. So only get this information from people you trust, and that will help you understand this virus better and get only the most accurate and true information around it. Now, there is a lot you and me can do as a community to make a difference in these difficult times. Let's see how we can start. The first thing that we can do is only try to prevent this virus. So some advice that I can give you to help prevent the spread of the virus will be as follows. As you must have heard a lot about this as well, hygiene and sanitation is the number one thing that can help you from prevent you from getting the virus itself. And when I say hygiene and sanitation, there can be various ways to do this. Most importantly, washing of your hands. That too with a good antibacterial soap that can clean out any germs that are on your hands, or if you've touched any surfaces, it can also clean that out. So, number one, use soap and water. Now, even to use soap and water, there is a certain technique that is used that is recommended by the World Health Organization in about 7 steps. I will show you how that is done in a few minutes. Remember that if you wash your hands, it's not enough just to put your hands under the tap, put a little bit of soap, rub it off, and then you're done with that. It doesn't work like that. It has to be done in a very, very nice manner. You have to wash at least for 20 seconds in running water. Sometimes it helps to maybe sing the happy birthday song in your mind. It will take around 20 seconds. So you can sing that in your mind, and 20 seconds will pass, and then you'll know you would have washed your hands for a sufficient amount of time, and that the soap has gone in several places around your hand. You also have to do this washing after using the bathroom or being in public spaces or anywhere where you feel you have touched your hands on various surfaces that have not been clean. and try to get into all the nooks and crannies around your hand. So the steps involved will be as follows. You have to first make sure that you apply the soap on your hands, rub it around your palms very well. You then do it between your fingers, right on the top as well as the bottom, both your hands. You'll then have to also wash your thumbs, rub both your thumbs around it very well. The palm of your hand can also be used to rub right here for a good 5 seconds in every location that I'm telling you, and then all around your palm this way, and then use running water and wipe with a nice dry cloth. So fingers, palm to palm, and fingernails also have to be covered. Now there are times where you will not have access to a basin, water and soap. That's when you can use a hand sanitizer, especially when you're on the move. But make sure that when you use a hand sanitizer, it has at least 60% alcohol. Only then will it be effective in killing any germs that may be present on your hands. So besides cleaning our own hands, it's also important to clean frequently touched surfaces. Now a person in a day touches various surfaces without knowing several times, and then you touch your face. You wouldn't have known whether that surface actually contains the germs, when was it last cleaned. You may not be aware of that. So it's very important to take extra steps, especially during this time, to make sure that you clean all surfaces around you in your homes. With a disinfectant is preferred. This is an interesting slide that I've put up here so that you can have a look at how long can this virus stay on various surfaces. You might want to know, will it stay there forever? How long can it stay on various types? So as you can see, the longest this virus can stay on is for a few days on material like steel. It can stay on plastic as well as on wood. It'll stay for a less amount of time, like 24 hours on cardboard, and then very few hours on some surfaces like copper. So that just goes to say that if you have a lot of plastic around you, a lot of steel and a lot of wood, make sure that those surfaces are cleaned very well and very often, so that you don't touch it while it is not yet disinfected. Moving on, there are some other practices that you can follow as part of the hygiene and sanitation practices. You might sneeze or cough. Now, like I had mentioned earlier, the one way this virus can get transmitted is if you touch a surface that has been infected. It can also come through respiratory droplets of somebody coughing nearby or somebody who is sneezing nearby. And that's why it's important to wear masks. That's why you see everybody around you wearing masks, so that none of those droplets can enter any of your airways and get you infected. So when we sneeze, it's very important to sneeze into your elbow like this, or hold something on your mouth versus just infecting somebody else around you. So this is one practice you should do not only during these times of COVID-19, but always, as good hygiene practices are important for better health. Next thing, we try as much as possible to avoid touching your face. I know it can get difficult, and unconsciously you may want to touch your face, you may want to rub your eyes and your mouth when you have not cleaned your hands. But it's very, very important that you, in this time, to avoid touching any parts of your face, especially from here on. No touching of your eyes, your mouth, or your nose. Now, besides hygiene and sanitation, another important way that we can prevent the virus or prevent the infection of COVID-19 is through social distancing. You must have heard this word a lot during the last couple of months. So social distancing, as you may already know, is keeping a safe distance from other people. It could be your family members, it could be your neighbors, your friends. And in this time, you're actually practicing social distancing by not coming to school, right? So social distancing is very important to make sure that so let's say if somebody is coughing, sneezing, or has any chance of handshake or anything like that, there's less contact because you're maintaining a safe amount of distance. And this distance, when I say, is not very close by. You have to keep a minimum distance of at least 1 meter, that is about, or at least 3 feet distance between yourself and other people. And it's very important to remember that you maintain social distancing, especially with older adults who are susceptible to this infection. The closer you come to them, the higher chances there is for them to get the infection and then succumb to it. So try as much as possible to maintain distance. I know it might be difficult during these times. You'll probably miss playing with your friends in school, being around them. It's not. I know it is difficult and you feel sad about it, but during these times you can go out to play with your friends, but make sure that you maintain that 3 feet distance at least. This is the third point that you can contribute to in order to improve situation during this COVID crisis, is do not stigmatize. So I know many of you will be worried if you come back to school, you might be worried, oh, if I see somebody coughing or sneezing, he has COVID, let's not go close to him. Now that's not something we can do. Remember that COVID is something that does not affect one particular community, a person of a certain color, a person of a certain religion. It affects everybody, all age groups, no matter what color, country, or society you come from. So make sure that you do not stigmatize your peers about being sick and support them during these times. Now, I've given you lots of information. So it's time we self-assess. I have this interesting quiz that I will play for you. What you can do is, I will have a question up here on the screen. Take a few minutes to think of the answer. Whether it's true or false, whether it's a myth or a fact. There will be several statements that I will be putting up here. There will be some things that maybe I have not told you during this presentation, but if you may have got that knowledge from elsewhere when you have been reading about the virus. So there'll be about 10 questions up there. I'll play them one at a time. I'll give you a few minutes. What you can do is grab a pencil and a paper and note down your answers one by one as we bring up the statements. And then we'll calculate scores to self-assess. So is everybody ready with your pencils and your paper? Okay. So we'll start with the first statement. We'll do a trial run. This will be a trial statement that I put up here, so do not take that into consideration when you're scoring. Okay? Let's try this. So the first statement here is, you can protect yourself from COVID-19 by injecting, swallowing, bathing in, or rubbing onto your body bleach, rubbing alcohol, or disinfectants. Now, is that true or false? Think about it for a minute. Can we inject disinfectant in our bodies to kill the virus? Whatever you think is your best answer, note it down, and then we'll review it towards the end. If everybody is ready, I'm going to now show the answer up here. And the answer is false. No. So you cannot protect yourself by using disinfectant or rubbing alcohol or any of these things. In fact, it can be extremely dangerous for you to do so. Remember, like I said, the only thing that can help you prevent or cure it is a vaccine, which has still not been discovered, has not been out there. So in the meantime, please do not try this at home because it can be dangerous. So now we will actually start the quiz. This was a trial run. So I'll give you like a minute. You can be ready for the next question, which will come up here. And then we'll quickly move on to question 2, 3 and so on until we reach question number 10. Everybody ready? Let's start. So here's the first question for you. There are currently no drugs licensed for the treatment or prevention of COVID-19. I'll repeat that. there are currently no drugs licensed for the treatment or prevention of COVID-19. Think about that. Do you think there is any drug out there that can save us from COVID-19? So, I hope all of you have written down your answers, because I am showing you the answer right here. It's a fact. It's true that right now there are no drugs, like I said before. If you have been paying attention in my presentation, I said there is no drug or vaccine that is out there that can help treat or cure COVID-19. There have been articles and discussion in the news around a drug called hydroxychloroquine. But remember that it is not an approved drug, and there is no evidence yet out there that it is a cure for COVID-19. Next, adding pepper or chili to your soup or other meals does not prevent or cure COVID-19. Is that true or false? So, the answer is true. If you add chili to your soup, it's really not going to help. You will only find it spicy, nothing more than that. It'll add to your taste probably if some of you like spicy food, but it really doesn't help with curing or killing the virus. Next, COVID-19 is not transmitted through houseflies. Has anybody heard this in the newspapers maybe, that COVID-19 is or can be transmitted through houseflies? So is it true or is it false? Is it a fact or is it a myth that COVID-19 can be transmitted through houseflies? Okay, let me show you the answer. Many of you must have got this correctly, I hope. COVID-19 is not transmitted through houseflies, and it cannot be. Like I will repeat again, COVID-19 can only be transmitted from one human to the other through respiratory droplets when you're coughing, sneezing, or if you've touched a surface where some of those droplets may have fallen from an infected person. That is the only way you can get the virus. Next, 5G mobile networks do not spread COVID-19. Is it true or is it false? Do they spread? Can 5G networks spread COVID-19? I know I've heard this, several articles about it in the paper. Do you think it's true or false from what I just told you? I think many of you may have got this fairly quickly. From what I just said earlier, nothing else besides human-to-human transmission can spread COVID-19. So definitely no 5G mobile networks can spread COVID-19. They cannot. Next, this is also another common statement that I've been hearing, so I wanted to add it here. Exposing yourself to the sun or to temperatures higher than 25 degrees Celsius does not prevent coronavirus disease. I'm going to repeat that again. You have to tell me whether it's a fact or it's a myth. Exposing yourself to the sun or to temperatures higher than 25 degrees Celsius does not prevent coronavirus. I know many of you were waiting for the summer to kick in because there was a lot of information out there about the virus being killed in hotter climates or higher temperatures, but sadly it is not the truth, and it is a fact that exposing yourself to the sun or to higher temperatures will not prevent the spread of coronavirus. It doesn't matter whether it's a colder climate or it's hotter climate. There is no evidence that temperature itself can kill the virus. Research is still ongoing, but countries with hot weather also have it. India has it, and it's very hot here. We have cases rising. So Remember that exposing yourself to the sun or being in higher temperatures is definitely not going to kill the virus. Let's move on to the next. Being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from the coronavirus disease or any other lung disease. What do you think, students? Do you think it's true that if you hold your breath for 10 seconds or more, does it prove that you do not have the virus? What do you think? Give it a minute and think about it. If I hold my breath right now for 10 seconds, do I pass the test for coronavirus? Think about it. So the answer is, students, that it's a fact. Being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean that you do not have the virus. You could very well have the virus and you're able to hold your breath because you've not reached a severe stage probably. So do not think that if you can hold your breath, that you do not have it. You could very well have it. And remember, students, a lot of patients out there in the community that have been found to have COVID-19 or have been COVID-19 positive, they have been asymptomatic for a long time. So what I mean to say is many patients will not feel any symptoms that we talked about earlier. They will be absolutely normal, they won't have any symptoms, but they may actually have the virus and it can show up a little bit later. Okay, the next one. COVID-19 virus can be transmitted in areas with hot and humid climates. So this is similar to the question that we had talked about two statements earlier. So I hope you get this answer correctly. COVID-19 virus can be transmitted in areas with hot and humid climates, such as Goa. I'm going to move a little bit faster on this one because I'm sure you've got this right. That it's a fact, COVID-19 can be transmitted in areas with hot and humid climates. Humidity or hotter temperatures does not matter. Like I said, I'm reminding you again that hotter temperatures or colder temperatures, temperature will not really determine the spread of the disease. So the best way to protect yourself, whether it's hot or cold, is to maintain social distancing as well as maintain good hygiene practices. The next one, this is the second last one. Eating garlic can help prevent infection of the new coronavirus. I've heard this interesting one as well. Many of you must be having garlic in your homes and may have probably heard it on social media or on your newspapers, that if I eat garlic, it can help prevent the COVID-19 infection. Do you think so? Can it? Ask yourself. What do you think? Yes, you are right. Eating garlic in no way can help or cure the spread of coronavirus. Garlic is a healthy food that has many antimicrobial properties, but in this particular case, garlic cannot help prevent COVID-19 or the coronavirus. The next one, and this is my last statement, so I hope you get this correctly. Antibiotics are effective in preventing and treating the new coronavirus. Can antibiotics treat coronavirus or COVID-19? Give it your best guess. So the answer is no, antibiotics are not effective in preventing or treating the new coronavirus, because like I said, the only thing that can help prevent this virus is a vaccine, which we do not have at the moment. Antibiotics are primarily used for bacterial infections and not for viral infections. Hence, they prove to be ineffective in this case. So please do not use any antibiotics, or do not force your doctors to prescribe you any antibiotics unnecessarily if you think you have flu-like symptoms or you feel like you've got COVID. Please stay calm, don't worry, and do not unnecessarily take these antibiotics. So I hope all of you have enjoyed this little quiz, and it really helps to see how much you are aware of the disease. I will be showing you the ranges here of the different scores. So you can do a quick count of 1 to 10 from the first statement that I put up on the screen to the 10th statement. For your every correct answer will get 1 point, and obviously a 0 for the wrong answer. So please go through and do a quick calculation of how many you've got right, and see where you stand up here against your classmates. So if anyone's got 10 on 10, that's excellent, very good. I'm happy that all of you were actually listening to what I was saying and have got all the statements correct and have added knowledge of COVID-19. 8 to 9 also very good, almost there. 5 to 7 would be considered good, and 0 to 4 you'll need a bit of improvement. I'm sure you can go over this presentation again and reassess yourself. I'm sure you'll improve and you'll fare better. So all in all, the most important thing, students, just remember that it's important to stay safe, not only for yourself, for everybody else out there. Definitely try to use some of the prevention tips that I've given here, and if there's anything more that you would like to know from me, I'll be available for any questions that you can email me on healthedu@manovikas.in. Until then, please stay safe, healthy and happy in your homes. Thank you.